Assalamu alaikum dear doctors. In this video I am discussing about diuretic, and these topics I have taken from RCPCH Theory and Science RCPCH book case number 14. Okay. Diuretics. Diuretics are agents which promote water and electrolyte excretion and are predominantly used in conditions of fluid overload, electrolyte imbalance and renal failure. They are classified according to their mechanism of action, and it is this which determines their specific clinical indications and their impact on plasma biochemistry. Now, these are loop diuretics, thiazide diuretics, aldosterone antagonist and osmotic diuretics. All are very much important. Loop diuretics. Example is furosemide. Furosemide, as suggested by their name, loop diuretics act in the loop of Henle, where they block the sodium potassium to chloride ion co-transporter. So, furosemide mechanism of action is sodium potassium to chloride ion co-transporter. This common exam. In doing so, there is increased excretion of sodium, chloride and potassium as well as water due to a reduced concentration gradient in the medullary interstitium at the tip of the loop of Henle. Use of loop diuretics can lead to hypovolemia, hyponatremia, hypokalemia and hypochloremia. So, furosemide using what electrolyte changes occur? This is hypovolemia, hyponatremia, hypokalemia and hypochloremia. In response to low potassium, there is reabsorption of potassium which secretion of hydrogen resulting in a metabolic alkalosis. Remember, furosemide causes metabolic alkalosis. This reabsorption of potassium is not enough to prevent hypokalemia, increased excretion of calcium leading to hypercalciuria, and magnesium causing hypomagnesemia also occur. So, increased excretion of calcium leading to hypercalciuria, hypomagnesemia. Two questions come from furosemide. One, where it acts, that is ascending limb of loop of Henle, and mechanism of action is sodium potassium to chloride ion co-transporter. Now, thiazide diuretics. Example is chlorthiazide. Thiazide diuretics are act in the distal convoluted tubule. Remember, thiazide act on distal convoluted tubule by inhibiting sodium chloride reabsorption. Only 5% of sodium is reabsorbed in the distal convoluted tubule, and thus there is only a small increases in the overall amount of sodium chloride excreted, and their diuretic effect is relatively weak. Side effects include hyponatremia, hypokalemia and metabolic alkalosis. So, thiazide diuretics side effects include hyponatremia, hypokalemia and metabolic alkalosis. Thiazide diuretics also increases the reabsorption of calcium in the distal convoluted tubule and can therefore cause hypercalcemia. Chronic diuretic therapy, both loop and thiazide diuretics, also causes hypercalciuria by increasing reabsorption of uric acid in the proximal tubule, secondary to volume depletion, and as the diuretic itself completes for secretion in the proximal tubule with uric acid, thereby reducing the amount of uric acid secreted. So, thiazide diuretics, chlorthiazide is example. Its act on distal convoluted tubule, and mechanism of action is sodium chloride reabsorption by inhibiting, and like furosemide loop diuretics, it also causes hypercalciuria. Now, aldosterone antagonist. Example is spironolactone. By blocking the action of aldosterone in distal convoluted tubule and collecting duct, sodium and water excretion is increased. However, in contrast to other diuretics, potassium and hydrogen are spared as they are no longer secreted in exchange for sodium. Thus, side effects include hyperkalemia and metabolic alkalosis. So, aldosterone antagonist example is spironolactone. This question come on the exam. Spironolactone mechanism of action. So, that is an aldosterone antagonist. Remember, aldosterone antagonist is spironolactone. It acts on distal convoluted tubule and collecting ducts, and it causes we are seeing that hyperkalemia, where the loop diuretics and thiazide diuretics, both side effects are causing hypokalemia. Now, about osmotic diuretics. Example is mannitol. Osmotic diuretics act by altering the osmotic pressure in the renal tubule. They are freely filtered at Bowman's capsule and increases the osmolarity of the filtrate within the tubule, which reduces water and subsequently sodium chloride reabsorption. Excretion of all electrolytes increased. For further details concerning the mechanism of action of mannitol, see chapter 34. So, chapter 34 they give the explanation of mannitol. So what is the example of osmotic diuretic? That is mannitol. Now I am again repeating all the diuretics according to site. So loop diuretics is furosemide and it acts by sodium potassium chloride ion co-transporter and acts on ascending limb of loop of Henle. And thiazide diuretics example is chlorthiazide. And thiazide diuretics acts in the distal tubule by inhibiting the sodium chloride reabsorption. By inhibiting sodium and aldosterone antagonist. This is very important. That is spironolactone. Aldosterone antagonist that acts by blocking the action of aldosterone in the distal convoluted tubule and collecting duct. And osmotic diuretics is mannitol. Osmotic diuretics act by altering the osmotic pressure in the renal tubule. Please do subscribe and share my channel, everyone. Thank you.